please make sure you're confident breastfeeding before you leave the hospital, because after you leave the hospital, the support is very variable. So babies who are breastfed have reduced ear infections, reduced pneumonia by 72% reduction in hospitalization with pneumonia, reduced upper respiratory tract infections. They also have reduced risk of obesity, asthma, allergic disease.
I hope that they can give new mommies like more for 2 years, maybe.
Yeah.
Maternity leave, that would be much better for them also as well, like 6 months to 12 months. They shouldn't take any gluten, any wheat, any rice, carbs or complex carbs even, more protein, and then they can start being introduced afterwards. So if we go to the after giving birth and recovery for the mummies, where like hormones are ups and downs during that period, and women doesn't know when is it going to be normal again and how to handle this. There may be like mood, different mood or changes in the mood all the time, and of course like taking care of the baby, being a new mom and the stress around it. What kind of stuff mommies need to do to support her recovery at this point?
So ideally, you've prepped this beforehand. You've identified people who are going to help you out. You've got some food ready in the freezer. You've identified your village that's going to help you out. But really, what mums need to do is they just need to focus on de-stressing, recovering, taking care of the baby, and not worrying about anything else. So we do have a quick and a very sharp drop in hormones after birth. So that's why we can have these mood changes, where what we call baby blues. If that is persisting, though, for a long time, we do need to seek medical support at that point if we're having persistent low mood. But baby blues tends to last for a few days whilst those hormones are adjusting. But my biggest advice is just rest as much as you can and be with your baby as much as you can.
I just want to touch down on this. If it persists to be for a longer period, is this like could be like a postpartum depression?
Yeah, it could be the start of postpartum depression, and it's not always sadness. It could be irritability, anger, lashing out, just not feeling yourself. If that's you, or you have, you're not connecting with your baby, and you're not finding joy, or you're feeling like you might want to hurt yourself, then those are definitely reasons that you need urgent support.
And after addressing these issues, I want to know also more about breastfeeding. So women have sometimes challenges during breastfeeding, whether there is a tongue tie or lip tie affect the baby's feeding. And in this region also it's not addressed that much. So how can she know that there is a problem, or how can she address these issues with breastfeeding if she has any?
My biggest advice is when you're in the hospital, please make sure you're confident breastfeeding before you leave the hospital, because after you leave the hospital, the support is very variable. I would advise women to harvest their colostrum when they're pregnant. So if there is any problem with the birth plan doesn't go according to plan, and there is a problem with you feeding them, at least you have some colostrum to give the baby immediately in the hospital. You can freeze it and take it to the hospital on ice when you're going into delivery. In terms of tongue ties, so breastfeeding shouldn't be painful at all. And so if it is painful, that's your sign that something is off and it needs to be checked out. Usually the baby will be checked and assessed for tongue ties at birth. And so a specialist, either pediatrician or neonatologist, will actually check to see if there is a tongue tie there. And if there is a tongue tie there, that may affect breastfeeding. So you should seek the advice of a lactation consultant very quickly, because babies can't go more than 3 hours without a feed. So it's an emergency that you need this checked out as soon as possible. Most women can breastfeed. It's just that the positioning and the latch isn't always right, and it's not always easy. People think because breastfeeding is natural, then it should be easy. That's not always the case, and you may need some help along, and that's absolutely fine.
When you should start the colostrum, you said harvesting before delivery. So when you should start doing it?
You can do that several weeks before pregnancy and just store them in the freezer. And a good lactation consultant or midwife who's trained in this will be able to show you how to harvest your colostrum and store it safely so that you can take it to the hospital.
So before giving birth, like several weeks, she can harvest this, and then she can put it in the freezer. How long does it stay in the freezer?
Well, if you take it to the hospital on ice, then it will stay cold in transport. And then if you have to have something unexpected done, like an unavoidable C-section, then at least, if you're in the operating room, the baby can still have its colostrum.
And so if there is a problem with the breastfeeding, like other than those problems, like it's not enough, the milk is not enough for the mummies, and she needs to use formula. What would be the approach at that point here?
Okay, so like I say, the best thing to do is to troubleshoot with a good pediatric osteopath, with a good lactation consultant to try and get the milk back up. You can always relactate. So even if you have to give your baby formula for a short period of time, you can, once the latch or the position improves or you've had the tongue tie dealt with, you can relactate, which means gradually coming off formula whilst you increase your milk supply. So just because you initially have a milk supply that is a bit low doesn't necessarily mean it has to be like that for the duration of time. But if we do need to use formula, then I would look for a very clean formula, one that doesn't have seed oils or added sugars, which can look like high fructose corn syrup or maltodextrin or added fillers. Ideally one that's been screened for heavy metals. I mean, there was a recent outbreak of botulinum toxin in a particular baby formula in the US. So the thing with baby formula is it can contain mold, it can contain bacteria, and that's why you need to actually heat the milk to a very high temperature to kill off anything that's in there. The things like the botulinum toxin, though, they don't always go with heat.
Wow. So reaching also to after the breastfeeding period, I think it's the first period that only breastfeeding will be from 0 to 6 months. Is that correct, or more than that?
Well, ideally for 2 years, but because that's very ambitious as a target. So most places will say 6 months, but the benefits of breastfeeding increase up to 2 years of age, with the majority of the benefit being in the first year, and that second year being that just kind of consolidation of the benefits of breastfeeding. So breastfed babies are protected against a wide range of diseases because they don't have antibodies, they don't have a really good immune system when they're born, they can't fight off infection, they have to get it from breast milk. So babies who are breastfed have reduced ear infections, reduced pneumonia by 72% reduction in hospitalization with pneumonia, reduced upper respiratory tract infections. They also have reduced risk of obesity, asthma, allergic disease, all of these chronic health conditions in babies. Sudden infant death syndrome is reduced, diabetes is reduced. The children have a higher IQ who are breastfed, even at the age of, when you come and look at them at 6 years old, they have a higher IQ. So breastfeeding has a myriad of benefits that we should aim to continue breastfeeding as long as we can. And I'm not saying this to offend anyone. I'm just saying this from a very scientific perspective. Breastfeeding is a collective social responsibility where unfortunately these days we've put corporate interest before the interest of the mother and baby. So if a woman is having to go back to work at 6 weeks and you spend 40 hours a week breastfeeding, you're doing 2 full-time jobs. It's going to be very stressful and very difficult, and stress actually leads to low or less milk production. So women who are very stressed out, it can be really difficult, can be really challenging.
Well, I hope that they can give new mommies, like more for 2 years, maybe. Maternity leave, that would be much better for them also as well. Like
lots of places in Europe have long maternity leaves of a year plus, which is absolutely what we should try to implement here as well.
Yeah. Mm-hmm. So baby-led weaning, when should she start doing this? What's the difference between actually baby-led weaning and spoon feeding? So like I keep hearing this, it's like a trendy topic nowadays. And before we didn't even, especially in this region, we didn't know about it. I'm not sure about the Western region. So what is it exactly to start with?
So baby-led weaning is where we let the baby have autonomy as to how much they're going to feed themselves. They regulate themselves. They eat with their hands, or they pick up a spoon and self-feed with a spoon. And they can regulate their own food intake. And this is really important because we teach the baby how to respect their own hunger cues. And this avoids the child having obesity in later life. People are really, really obsessed with making sure the baby eats loads of food. But what we really need to look at is how can the baby learn to eat and respect their own stomach and feeding cues?
Well, if we gave the baby the food and they don't finish the full plate, because like our grandma and like our moms always said, like, you have to finish your plate and you have to finish it all. Oh, he didn't eat enough. So that actually, it's not true. They can just like, they know their cues of hunger and they're just like...
Absolutely. You don't, they do. So they should respect what their body is telling them, and they will eat until they will satisfy their hunger. People are really obsessed with measuring the child's weight and putting them on the scales and making sure they finish their food. There's really no need for that. The baby will eat until they're no longer hungry, and that's what we should be encouraging with high quality food. And babies at 6 months, especially if they've been breastfed, have a really strong jaw. They don't need liquid food. They can have soft, solid foods to start off with from the age of 6 months. And we don't recommend weaning before 6 months because it can increase the risk of problems in the baby. But after 6 months, you can give them soft, solid food, which they can use their own hands to pick up, or they can use a spoon to self-feed. And that will be very helpful for the baby's development later on.
Does this involve also their jaw development? So if they're feeding themselves with solids, like hard solids, does this mean they can eat also like organ meats, for example, or carrots, like boiled carrots or something like this? Is it okay for them to eat it?
Yes, so breastfeeding strengthens the jaw, it widens the jaw, it brings the jaw forward. But then the next best thing is starting the baby on these solid foods, because again, it expands the jaw, it expands the airway, so they don't have airway problems in the future. So starting on solids and baby-led weaning is really helpful for their jaw and airway development later on. And like you say, things which are ideally finger foods, things which are stick-like foods, which the baby can pick up themselves, like soft carrots, and they can mush, and that won't get stuck in their throat and won't cause any choking. So we have to be careful about how we prepare the food, but the baby can start off with solids.
So no ready-made mashed potatoes, or I don't know, like those mix of fruits, or that's already in the market, right?
So the things that are available in the supermarket are perhaps some of the worst foods to start your baby on, particularly things like baby rice cereal is one of the worst foods to start your baby on. The baby, when at 6 months, doesn't have the amylase to break down carbohydrates. So we don't really want to be giving the baby carbs like rice or potatoes. What we want to focus on is protein, things like meat stock, bone broth, bone marrow, bits of steak, which you can cut into finger-like pieces. They won't be able to chew it, but they can just suck on it and extract some of the juices from it. And then also vegetables, particularly bitter vegetables. At this age, they will take anything. So focusing on bitter things is really important, because they will be exposed to sweeter things later, and they will show a preference for that. So what we're doing at the beginning in that first year of life is shaping their taste preferences. And if we want them to eat vegetables later on, we need to expose them to vegetables at the start.
Then what about food sensitivities and allergies? So if the mom, for example, have peanut allergies, or allergies from strawberries or other stuff. So what do you recommend at this stage? So also, should we include this in their food, or we shouldn't include, we should avoid it? Or there are certain tests to actually tell if they have food sensitivities or not at this young age?
So where there has been a family history of allergies, and how we try to reduce the risk of allergies is actually by proactively introducing these foods once the baby is weaned. So if there is a strong history, for example, of peanut allergy, we want to actually introduce peanut butter, smooth peanut butter, very early on at 6 months, because that reduces the risk that they are going to be allergic to it in the future. And then we want to expose the baby to other things that we are commonly allergic to, like seafood, that we can introduce in the baby's diet, things like sardines, shrimp. We can introduce to the baby different nut butters, hazelnut butters, almond, smooth, nut butters. We can give to the baby to protect them against developing an allergy to this later on.
Does this mean that developing allergies actually happen? They're not born with it. When they grow older, they actually develop certain sensitivities and allergies.
So allergies are related to the immune system, and nobody still, understands the immune system fully. But immune system development is really important, and it depends on what we're exposed to in those early years of life. It depends on the microbiome. It depends on what's in our environment. So the immune system recognizing that this is a safe food is really important, which is why we encourage that early introduction.
And what about honey? Because some doctors or some approaches, they say introduce honey before 1 year, and some they say, and most doctors they say, of course not.
No,
it's after 1 year.
After 1 year.
Why honey is after 1 year?
So honey can contain some toxins which can cause kind of paralysis in babies. So we don't want to really risk that. Okay, so honey after the age of 1.
So no gluten, no wheat, no carbs before at the beginning. So after 6 months to 12 months, they shouldn't take any gluten, any wheat, any rice, carbs or complex carbs even, more protein, and then they can start being introduced afterwards. Or
12 months the amylase starts to increase a little bit, so sort of 12 months onwards would be, but under the age of 1, their primary food is still going to be the milk. So the foods that we're doing before 1 year of age are there to get them used to the texture, get them used to the taste, get them used to how to eat, get them used to how to swallow. So it's not going to be the bulk of their diet. It's just going to be something that's nice to give them because they are still relying on the milk.
Wrapping up to this section or this part, I just want also to address the fact that there is always shaping the baby's microbiome topic. We said that before pregnancy, the mom actually taking care of herself is actually moved to the baby afterwards. If there is certain problems or the mom didn't take care of this at the beginning, how can we address this part after birth when we have the baby? Is there a way to shape the baby's microbiome at a young age, or afterwards? If there is an issue, we will address it anyway.
I mean, probiotics in babies may be helpful, especially if they're breastfed. So probiotics are one way to go. We can give the baby probiotic foods. So fermented vegetables or the juice of fermented vegetables can be very helpful for babies to get lots of probiotics into them. And the mother, so improving the mother's gut health actually improves the quality of the breast milk. And her milk can contain more antibodies, more nutrition.
MashaAllah, subhanAllah. So moving ahead, and childhood nutrition and development issues that might face the child and parents. We said that food sensitivities and allergies we have to address it when the baby is still young. But if we did this and we took care of everything, but afterwards the baby is a picky eater. The child, anyway, when he gets older, the toddler is a picky eater. A certain food he doesn't want to take. So we should keep him like this and not give him the food or feed him in a certain nutritional way. What do you think about this when kids actually generally are picky eaters?
So babies don't tend to be that picky. As they grow older, they become more picky. That can be an environmental influence. If they see everybody else having a particular type of food, they might want the same. But it can also be a sign they have an underlying gut issue. So if you have underlying gut infections, that can actually affect your taste preferences in terms of what you want to eat. So we can check the baby microbiome, we can check the toddler microbiome profile and try to optimize those from using a functional medicine kind of protocol.
And so if we said that everything, alhamdulillah, is perfect and everything, when it comes to the age of vaccination, or the part where vaccination should be taken, parents are always lost nowadays. Like, we don't know, like, what type of vaccination we should give our kid, what type of vaccination we shouldn't give our kid. So how can we approach this issue of vaccination from a point of understanding more?
So when the baby is first born, they don't start producing antibodies immediately. They need passive antibodies. They start to produce antibodies 6 to 12 months of age. We are all born with the hardware for the immune system. We don't have the software programs on yet. The software programming comes from mother's milk, environmental exposure, and the foods we're exposed to. Well, the vaccines come in and they put on a program. They put on this program that you are now going to respond to whatever is in the vial. And that may be bits of viruses, bits of different kinds of viruses, but also the excipients in the vial. And so they put on that program at a critical period of development. So what we can do from a functional medicine perspective is look at pharmacogenetics, look at the baby's ability to detoxify drugs, and from a genetic perspective. So this looks at their liver enzymes. The liver enzymes get rid of chemicals that are in the body. And so that's important to note because different individuals will process medications differently. And so we can do this pharmacogenetic testing, and then that will give us a good guide.
So this is done before taking the vaccination or after taking the vaccination?
We can do both because the childhood schedule will be quite an extensive, across quite a length of time. So if your child has already had vaccines, we can absolutely check them over. We can also check the gut health, make sure they're not nutrient deficient to optimize their response. So you can do it before or after.
And so is there like a red flag that parents should be aware of when it comes to like certain challenges that they see with the kid or the baby when they're growing up? Is there some certain of markers they should be aware of at that point? For example, if the baby is not have a delay of speech, for example, or is this like a marker, like he's delayed in speech, for example? This is something that we need to take care of, and is it like impacted by the environment around us also as well?
Okay, so not all delays are a sign of a problem, but delays can be a sign of a problem, so it's worth getting them checked out if your child does have a delay. So one of the first things when the baby's very young that you might notice is they don't smile, they don't track your eyes, for example. Mm-hmm. You might notice that they're just looking into space. They might not respond to their name, or even having that angelic baby that doesn't fuss, doesn't cry. You put them down and they just go to sleep. Sometimes that can be an early sign that there's something is off, as well as not meeting their milestones in terms of delayed walking, talking. All of those things could be a sign, not necessarily, but could be a sign. And if you're worried about it, you need to speak to your doctor.
Because parents are always like, they're anxious when it comes to the baby, especially first baby. Mm-hmm. So it's like, everything happens, it would be a red flag. Like, mm-hmm. So I just wanted to highlight like which ones are the red flags, which ones are like, it's okay, like it's the baby and their body, and this is how they develop, and take it easy. So don't be stressed about it.
We often see anxious parents, and that's totally normal. And I would just suggest speak to your physician, let the physician examine the child, and then we'll take a personalized approach from there.
I just want to highlight also the part where does the diet and exposure to toxins also impact the development of the baby or the development of the child, mm-hmm. The kids, because like I heard there are certain studies, even the room they are in also might impact their interactions, whether they're hyperactive or whether they're not active at all. Is this true or not?
So nobody definitively knows what causes neurodevelopmental disorders, but we have lots of associations, things that might be associated, and those can be environmental toxins, chemicals, heavy metals, artificial food colors and dyes. We can have pollutants in the air, in the water, that can affect mother during pregnancy and also the child afterwards. And there are so many things in our toxic chemical environment, like pesticides, that can all have an impact. So nothing is at this point to be excluded from consideration.
I want to touch base on addressing the tests that can be done for the kids with autism.
Okay.
What are those tests that can be done that might help and support the babies or the child at this point?
So I have a comprehensive program for our children with autism on the things that we check, and we're checking all bases from a holistic point of view. We're checking so many things for them. So we're checking their metabolic health, we're checking their mitochondrial health, we're checking their gut health, we're checking their nutrition status. We are checking heavy metal toxicity and environmental toxicity and mold exposure. We're checking things like Lyme. We're checking things like unusual infections. We're checking autoimmune disease, hormone levels, as well as other things. It's a really comprehensive program and many tests that I do for our children with autism so that we have a 360 picture of how we can help them. And they can be helped. So we have patients who have improvements in speech, patients who have better concentration, patients who are able to go to mainstream school. So there are real improvements that can be had, improvements in sleep, improvements in meltdown. There is so much we can do, and that's why we offer all of this comprehensive testing to have a full picture of them. Yeah.
That's amazing. And what about kids with ADHD? Also there is certain testing that can help us support them with activities and proper nutrition, like a certain way of addressing also their environment? Or
gut health is really important with ADHD, and the diet is a key cornerstone. And if we haven't done gut evaluation, we're missing a piece. A lot of children with ADHD can also have things like airway issues. So we do a comprehensive assessment for our children with ADHD to really optimize their concentration, and there's really good treatments that we can offer.
So for kids with on the spectrum or kids with ADHD, there is always a nutritional plan that can help and support them. Is that correct? And that this also this will impact their behavior later on and how they interact with their environment later on and their people around them and their family and everything. Would this be helpful at this point?
Yeah, so we can also do this from a genetic perspective, so nutrigenetics. So we can find out for that particular individual what nutrients they need for the rest of their life, because it's a genetic test. So what are their genetic vulnerabilities to certain vitamin deficiencies? And so that's a good test that we can do for our children on the spectrum and with ADHD as well, because when they're not nutritionally optimized, the rest of their behaviors follow suit in terms of possible deterioration.
I have a question.
Okay.
Just to wrap up everything, and everything would come together at the end of our episode. When it comes to kids who always getting sick, it's not ADHD. They're not, alhamdulillah, they don't have other more complications, but they're always getting sick. Like they're always having fevers, and they're easily getting sick. Or some kids nowadays have eczema a lot. Are those markers for gut health issues or something else?
Yeah, so eczema is strongly related to gut health, and recurrent infections can be related to gut health, can be related to immunity. So we would check all of those things in the blood work, but also in the gut.
And improving their nutrition and working on their nutrition and environment. This will help them.
Yeah, it's all part of the plan. We do a 360 assessment: lifestyle, diet, supplementation, medication, everything.
At the end of our episode, I would love to get advice from you for new parents or parents in general. What would be your ultimate advice for them?
My advice is plan, prepare, read up on everything, know what you're getting into, know about what's going to happen to you before it happens, and then enjoy the process, find the support, and enjoy your new baby.
Thank you. Thanks a lot for coming here and the amazing information that we got from you. Thanks a lot.
Thank you.
Thank you.